Thank you, Andy, and thank you to our friends in the media. I think the reason why we no longer have the high quality is because we continue to do this remotely, and not that Paul and I are just getting older so quickly during this pandemic. But as usual, I will start off with our numbers. As of this morning, Northern Light Health entities are taking care of 69 patients as inpatients across our system for symptoms of COVID-19. 7 of those are at A.R. Gould Hospital, 2 at Blue Hill Hospital, 41 at Eastern Maine Medical Center, 3 at Inland Hospital, 2 at Maine Coast Hospital, 2 at Mayo Hospital, 9 at Mercy Hospital, and 3 at Sebasticook Valley Hospital. In addition, we are taking care of 14 patients at home for COVID-related symptoms through our home care and hospice agency. And as you can see, this continues to be widespread across our state. The 2-week positivity rate is now 27.96%, and our 1-week positivity rate is 26.1%. While the positivity rate is trending in the right direction, it is still very high, and there is still a need to get vaccinated and boosted, wear a mask when in public, stay home if you are sick, and continue all other healthy behaviors that can make a difference. We also have available our most recent COVID-19 hospitalization graphic. The numbers continue to show that those who are vaccinated have lower cases of hospitalization and severe illness. As we noted before, this graphic represents a snapshot in time, and the data is constantly changing. The graphic, which includes data compiled yesterday, will be shared in the chat. And this week, I have one more graphic I'd like to share that shows the trends in incidence in COVID-19 cases and deaths for unvaccinated persons compared with fully vaccinated persons. This data was generated in 25 U.S. jurisdictions between April 4th and December 4th, 2021. The rates shown are per 100,000 people and show the dramatic difference in rates of infection and death between those who are vaccinated, especially if boosted, and those who did not complete a vaccine series. It also shows that the Omicron variant is more infectious than the Delta variant, but despite this, the vaccines remain effective. As anticipated, Pfizer and its partner BioNTech asked the Food and Drug Administration yesterday to authorize a coronavirus vaccine for children under 5 years old as a 2-dose regimen while they continue to research how well 3 doses work. While more work needs to be done before we can vaccinate the youngest segment of our population, this certainly is welcome news that we are moving in that direction and that we will be ready to do so when the time comes. At Northern Light Health, we believe that vaccination is our best tool to prevent the spread, serious illness, and death from COVID-19. While children are less likely to become seriously ill from COVID-19, it can happen. More often, they may share the virus with at-risk family members and friends. Some children with mild symptoms of COVID-19 have had longer-term health issues known as long COVID syndrome or post-acute COVID syndrome. Vaccination also means it is less likely that your child will miss school from COVID-19 illness or exposure. At Northern Light Health, we are trying to make it easier for people infected with COVID-19 to get outpatient treatment. We have developed a new tool on our website for patient self-referrals. If you have tested positive for COVID after performing an at-home test and have mild to moderate symptoms, you can go to the COVID-19 resource page at our website, northernlight.org, and click on the Get Treatment icon, or call 207-204-8551 to start the referral process. If, however, you're experiencing more severe symptoms like shortness of breath, even while resting, or chest pain, you will want to call 911 and seek emergency services. Northern Light Health is following the state and the NIH guidelines on prioritization of COVID-19 treatments. As we stated previously, the only recommended monoclonal antibody treatment for Omicron variant is sotrovimab, which is in short supply nationally. All patients will be placed as the drug supply allows based on 4 key elements: age, vaccination status, immune status, and clinical risk factors. Lastly, we want to stress that treatment with monoclonal antibodies after you are infected is not a replacement for getting vaccinated. We highly encourage everyone to get the COVID-19 vaccine. That is the best way to protect yourself and your loved ones. And with that, I'll turn it over to Paul for some staffing updates.
Thanks, Dr. Jarvis. Just as an update, as of yesterday, we have 550 Northern Light Health staff members who are out of work due to COVID-19 infection or exposure. And as a result, we remain in contingency staffing across our healthcare system. Just as a reminder, contingency staffing means that for COVID-infected employees can return to work after quarantining for 5 days and having a negative test. if they're asymptomatic or mildly symptomatic with improving conditions. This is stricter than CDC guidance, which does not require a negative test. And at this time, we have no COVID positive employees working on site at any of our healthcare facilities. And that was my only update.
All right, well, now we'll move on to questions. First up today, we have Allegra, WABI. Allegra, you should be able to unmute now.
Great, thank you so much. Dr. Jarvis, according to my calculations, it has been exactly 1 year since the mass vaccination clinic at the Cross Insurance Center opened. So I'm just wondering how you're feeling a year from that date. Are you feeling optimistic? Is this where we thought we would be? Or could you just offer some insight into where we are right now?
So as we said before, and thank you, Allegra, for the question, Maine has done a tremendous job in keeping this virus in check. We have one of the lowest mortality rates in the nation. We have one of the highest vaccination rates and one of the highest rates of booster vaccines in the nation. And those are all wonderful things, but we still have a ways to go. There is still approximately 20% of our population who is not yet vaccinated. Now, some of that includes children who are not yet eligible, but we also know that children ages 5 and up are eligible for vaccine, and we have seen a delay in that particular group of people getting vaccinated. These are the kind of things that we can all do that will ensure that our children stay in school safely and that we protect all the most vulnerable members of our community. So lots of encouragement there. It's good news to see that it appears that across the country, cases of coronavirus are decreasing, and we hope to see that soon here in the state of Maine. We have seen some slight decrease in our hospitalizations here as well, and so that's all positive things. I'm still tremendously proud of the individuals who dedicated their time and resources to our large-scale vaccination sites across the state of Maine. We know for a fact that saved the lives of many, many people here in the state, and we should all be proud of that. So thank you, Allegra.
Thank you. And then with that, we are still seeing, obviously, I know about probably 1,000 or so new first doses of the vaccine show up every day in that data. Do you have any idea whether that's mostly children that we're seeing, or if people are still coming around, adults, and deciding to get vaccinated now?
Yeah, I don't have any specifics on the breakdown of those numbers. I can say that we do see people of all ages who are continuing to decide that vaccination is right for them and that they want to protect themselves and their loved ones. And so we appreciate everybody that has been vaccinated. And again, those who are eligible for booster shots, we encourage them to get those if they have not done so already.
All right, thanks, Allegra, for your questions. Next up, we have New Center, Maine. Chris, go ahead and ask your question.
Hi, everybody. Can you hear me, Dr. Jarvis and Paul?
We sure
You
can.
can, Chris, thanks.
Okay. Thanks. I was just checking my microphone here. Hey, I wanted to ask you, on the news of Pfizer asking about its potential vaccine for the kids as young as 6 months. As we've done some more reporting on this, what we've noticed is a couple of things. One, the cases in kids under the age of 5, those who cannot get a vaccine right now, have appeared to go up pretty dramatically from November, December, and January, that each month keeps beating the previous total here in Maine. We also heard from Dr. Shah last week that generally speaking, the severity of the illness, and I believe you mentioned this too, Dr. Jarvis, that the severity of the illness in these young kids is, and then this is a relative term, less severe than what we see with adults. And I guess my question in all of this is, what kind of discussions are you having with parents? Because as we've seen, there has been some hesitancy on the side of parents to get their young kids vaccinated. What will you tell parents, either of 5 to 11 or of this group that is expected to soon become eligible, about the importance of getting a vaccine? What would you tell them?
Yeah, Chris, that's a great question. And so while it is true, most children who are infected with COVID-19 have mild symptoms and recover. The fact of the matter is we still have children that wind up in our hospitals, including in our intensive care units. And unfortunately, we have seen children, including here in the state of Maine, die from COVID-19 related illnesses. And that's tragic and preventable if they're at the age that could get vaccinated, or if those who surround those children are completely vaccinated and boosted. And so that's the one key thing. We also know that children with mild illnesses still have to remain home from school. And so if having your child in school so they can get appropriate in-person learning, vaccine helps to prevent that as well. And then lastly, while the data hasn't been clear yet, we do know there are cases of children who have been infected with COVID-19 and had mild illness who wind up having long haul syndrome from their infection. And often this presents itself as lack of ability to concentrate or focus, which again, at their prime age of them learning and developing their skill sets, we do not want them to have any detriment to their cognitive ability and ability to learn in an appropriate fashion. And so again, COVID-19 is a more serious thing than just the initial illnesses that people have. It is more than just a cold. It is more than just the flu, and it lasts a lot longer and has more long-lasting implications. And so that's really the discussions I have with my patients around their children, and the importance of why vaccines will help them to protect their children and the people that their children come in contact with. So thank you for the opportunity to say that once again.
Yeah, absolutely. I did want to also ask you about the antiviral treatments. I heard from a different hospital executive at Maine Health that apparently New Hampshire, which is a comparable population to Maine of about 1.3 million people, is getting a much larger allotment of the antivirals that we need, specifically sotrovimab. And I'm wondering, this is kind of a two-part question. I do know how the formula works, at least at the federal level, right? It's comprised of both population as well as hospitalization rate, as well as the incidence of infection, how many infections we're showing each day. I know the CDC backlog plays into that, but I know that Governor Mills had previously made that call, yada, 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 yada. I could go on forever about this, but the bottom line is this. One, have you had to transfer any patients to any hospitals in New Hampshire to make sure that they get that treatment? And two, would you prefer to see the formula changed so that Maine gets a comparable allotment to our neighboring states with similar population? Thank you.
Yeah, so I'm unaware of us needing to send anyone out of state for any particular treatment. We do know that we do have a ready supply of remdesivir, and so that while that is not a monoclonal antibody, it is a treatment that can be used for people with mild to moderate disease who are at high risk of complications for COVID-19. And so we do have that as an offering for us. We do have some sotrovimab, and of course the state has had some oral antivirals as well. We are working with the state right now to be able to be one of their centers that will be able to distribute those oral antivirals in addition to the monoclonal infusions and remdesivir infusions that we are currently administering. And so we will continue to work with that. I think, again, this may be somewhat of a factor of the fact that we have done so well in our state with such a high rate of vaccination that our case counts are lower per 100,000 than many other states are. And that's good news, but I also advocate for the fact that we should be getting enough medication in order to take care of anybody who is eligible and desires to be treated. As a healthcare provider, it is my first and foremost job to see to it that we provide the adequate healthcare for those who seek it. So thank you for that question.
Thank you.
All right, now we'll go to Patty White, Maine Public. Patty, you should be able to unmute now.
Thanks. Dr. Jarvis, there's a perception among some people that vaccines aren't necessary after they become infected because they have natural immunity, but there's some public health experts that are saying that most unvaccinated patients who are hospitalized were actually infected before. Is that something that Northern Light is tracking? Do you know how many of your unvaccinated patients had previous infections?
Yeah, I don't have the specifics on that. I can say that we do continue to see that, and we continue to see that with members of the community who do not need hospitalization. And in fact, we've seen that amongst some of our own staff members as well. Reinfection is certainly a possibility, especially the longer it's been since you had your initial infection. And if the initial infection was with the original strain of coronavirus, it probably offers almost no protection against the Omicron variant. And so that's the reason why vaccination is recommended for individuals, even if they have had natural infection beforehand. We've also have great data that says it doesn't matter which order happens, whether you're vaccinated first and then have a breakthrough case, or whether you had an infection first and then got vaccinated, that those individuals actually produce an even higher level of antibodies, and therefore will not only be protected against the Omicron variant that we're seeing now, but possibly for future variants that may be more infectious or worse, more deadly. So it is important that even if you've had that and have been infected, that you do get vaccinated and boosted if you're eligible for a booster shot.
Okay, thank you. And about the vaccines for kids younger than 5, can you just tell us about what the rollout will look like for Northern Light? I mean, where will kids get the shots once they become available?
Yeah, it's a great question. So of course, we do have to wait for approval for that. And so the process typically would be that the FDA would give the vaccine emergency use authorization. It would then go to the to ACIP, the Advisory Committee on Immunization Practices, and then to the CDC. And if that all follows through and all of those check the boxes, we will be able to administer that vaccine through any of our primary care and pediatric locations. In addition, if we saw the need, we would be able to stand up clinics as we have done in the past. And specifically, we had done for those students ages 5 to 12. We could do that if we needed to. I think most people feel comfortable, particularly with that younger age group, of having their primary care provider and pediatrician administering those vaccines. And so we will be able to do that, and have already started putting in place the process for us to be able to turn that process on if and when emergency use authorization is granted.
All right, thanks, Patty, for your questions. Next up, we have Joe Lawler, Portland Press Herald. Joe, you should be able to unmute now.
Hello. Yeah, following up on Patty's question, it almost sounded like you were saying for the under 5s that you anticipate there would be less of a need for stand-up community clinics, and that most of it would be taken care of in the doctor's office. Is that pretty much what you were saying, or I just want to make sure I get that right?
Yeah, like I said, we will be prepared for both. But what we saw with the ages 5 to 12 was that many people chose to have their child vaccinated at their primary care office. And we certainly have the ability to do that now. We've been doing that for several months. And so we feel very comfortable that we will be able to administer vaccines at our primary care offices as we have been doing. Again, if there are targeted needs where we would need to distribute that vaccine in other ways, including standing up a freestanding clinic for that age group, or doing some outreach via home care, or going to some community location, we are more than willing and capable to do that. Only time will tell what the need will be.
Okay, thank you. And my follow-up question is, there's been a pretty substantial decline in hospitalization since January 13th. I think 21% lower statewide. Are you seeing that in Northern Light Health, and is that helping with your operations any at all yet, or have you not seen much impact yet?
So of course, any decrease in hospitalizations, whether that be due to COVID-19 or any other disease process, would certainly be a relief to our staff, who have been working tirelessly now for basically 2 years, taking care of a significant increase in the number of patients than they usually would under extraordinary circumstances. So obviously we welcome any relief. We have seen a decrease in the total number of patients that we have had, but that fluctuates almost on an hourly basis and certainly on a daily basis. But at the present time, we continue to be in contingency staffing. And the reason why we are doing that is simply because of the high caseloads of all patients that we are seeing across our entire health system. So hospitals are still very, very busy. They're still very, very challenged, and anything that the community can do to assist us in decreasing the need for hospitalization or any medical care would be appreciated. And so again, that gets back to getting vaccinated, getting boosted, washing your hands, wearing a mask when you're in a public place, and staying home if you're ill.
Thanks, Joe, for your questions. Looks like we lost Ross from WMTW. So we're at the end of our list. We have a couple minutes left. If anyone wants to ask an additional question, just let me know in the chat. We'll give it 30 seconds. All right, Chris, go ahead.
I know we're all surprised that I have an extra question. Dr. Jarvis, I did want to ask you about the hospitalization graphic. I've been corresponding with your communications team and about the way that the data is presented. Obviously, one of the little people, it lights up green if they have received at least 1 dose of a vaccine, compared to the gray person who's received no doses. I was wondering I'm wondering how people can understand that data when we talk about breakthrough cases, because somebody who has one dose of a vaccine, I don't think would meet that definition, right? A breakthrough case is somebody who's been fully vaccinated and then catches the virus, right? Can you help people understand that, or if your team has decided to reanalyze how they present that data?
Yeah, so it's a great question. So you are correct. The CDC's definition of a breakthrough case is somebody who has been fully vaccinated. I mean, they have received they've completed their primary series. They have not yet changed that definition to include those who have had booster shots. And so you are correct in that regard. From our graphic standpoint, and where that particular data is pulled, all we can tell is that a person has had at least one dose of a vaccine. And so that's the reason why we've chosen to do that. We are working to improve that graphic to once again be more relatable to what's going on in the current situation, and then to assist in educating the population. But regardless, so even if we took out if we took those individuals out who had only had a single dose of vaccine and we put them in the unvaccinated category, that just even more dramatically shows that being fully vaccinated, particularly if you're boosted, really prevents hospitalizations, severe disease, and certainly death. And so that's the importance that people should see from that, so that if you're looking at it going, oh, well, look how many vaccinated people there are. Well, many of those people are not fully vaccinated, and most of them have some other underlying condition. And so putting those pieces together, once again, it just shows that being unvaccinated puts you at the highest risk.
All right, and now we'll move to Joe, Portland Press Herald. Joe, you should be able to unmute.
Hi, thanks. Yeah, just one more following up on the under fives, and I guess actually just kind of folding in 5 to 11s as well. As you know, like in Maine and a lot of the country, there hasn't been as much of an uptake amongst elementary school children and younger with getting them vaccinated versus older age groups. And I'm just wondering if there's any strategy, anything that can be done differently to get more kids vaccinated.
Yeah, again, I think that if anybody's out there who has concerns about vaccinating their children, they should reach out to their primary care provider and pediatrician in order to have those discussions. We know that these vaccines are safe in children. We know that for those over the age of 5, that the vaccines are effective in helping to prevent disease, and certainly in preventing severe disease in that particular age category. And so that's the information that needs to get out there. The information that was given to the FDA yesterday from Pfizer on children who are under the age of 5 also showed the safety of those vaccines, including having very, very mild side effects. And that's good news for us. And so, vaccines across the board are safe for administration, and vaccines are effective in preventing the diseases that they're supposed to cover. And so those are the important things that we need to do. Again, anybody who has questions should reach out to a trusted source. Usually that's going to be their primary care provider, and have those discussions with them.
All right, Allegra, you should be able to unmute now.
Thanks so much. I just had a follow-up when talking about just still the load that your hospitals are experiencing right now. What, if does it look like right now for someone who might, be coming to the emergency room for a broken arm? Do you know what those wait times are looking like, and what the sort of general of a well patient might look like right now if they do need to come to a hospital?
Yeah, I don't have any specific wait times, but I can say that there are definitely times when, regardless of what the situation is, that patients will need to be wait to be fully evaluated and treated. And that just has to do with the high volumes that we're seeing. Remember, we are not just dealing with COVID cases right now, but we have other respiratory viruses, including influenza, that are spreading across our state. And of course, we always have patients that are victims of accidents, people have heart attacks, people have complications from their other health conditions, and other needs for being in hospitals. And so putting all of that together has made it very, very difficult. Oftentimes, patients who are admitted to the hospital will either need to wait to get into a hospital bed, or worse yet, if they're at a smaller hospital and they need to be transferred to a level of higher care, there may not be a place for them to go, at least in the short term. And so that's a multifactorial reason for that. One, it's because of the increased need of patients to be hospitalized. And 2, for the fact that we don't have enough long-term care beds available for patients who no longer need to be in an acute care facility, but still need to have some health care provided at them and outside of their home. and not being able to discharge those patients. And that continues to be a problem across the whole state of Maine. And in fact, is a problem across the country. And so those are the challenges that healthcare workers face every day. And while we face those challenges, it's the patients who suffer because of them. And we are trying to do everything we can to manage every patient, to put every patient in the right place at the right time. But that is a difficult thing to do right now.
Thanks so much.
So let's end it here. Chris in the chat had a clarification, Dr. Jarvis, wondering what percentage of people hospitalized are completely unvaccinated versus boosted. Said that Dr. Marston addressed this in previous weeks. I don't know if you have anything on that.
I don't think I have any more specifics than what we've provided before. We can certainly look into trying to get that question answered for you, Chris.
All right. Well, we'll end it there for today. Thanks again, everyone, for attending and helping us get out the important information about COVID. As I mentioned before, if you'd like a copy of the Zoom recording, we have that and can provide that to you. That inpatient graphic and the booster graphic that were mentioned earlier in the briefing can be accessed through the link in the chat. If you have any trouble with that, just let us know. And thanks again for joining us today. Dr. Jarvis, any final words?
Just thank you once again. Appreciate it. And everybody stay safe and warm, especially with the new storm that's coming.
Thank you, everyone.